Hi, I'm Meg Callahan with Infectious Disease Special Edition, and I'm here with Lori Handy, who is the Associate Director of the Vaccine Education Center at CHOP. And I'm here to talk to you because there has been, maybe over the last year or so, there's been a lot of news going on within the federal government. But more recently, there was news about studies being withheld, specifically on COVID vaccination and shingles vaccination. Could you maybe give me a little bit of an overview of what you know to be going on?
So, what we know is that in spring of this year, there should have been a study published looking at the effectiveness of the COVID-19 vaccines for the past season. And that's been a type of publication that's been put out really every season for COVID-19 vaccines, similarly put out for flu vaccines and others. But for whatever reason, that vaccine study was written, kind of sent up the chain, as is often done at CDC. And then the acting CDC head decided that he had concerns over methodology and decided not to publish it.
Now, is it just me or is that highly unusual?
I think many folks know CDC, Center for Disease Control and Prevention, has its own journal called MMWR. And the reason it has that is because, CDC has our nation's data and wants to have a clear and easy way to share, new information, new data, things that our population might want to act on. And they have an incredible team of epidemiologists and scientists and biologists and vaccinologists who can kind of put that data together and make it usable and interpretable for the public or, for groups that might need to make policy decisions on vaccines. So, and other infectious diseases as well. And so what we expect to happen is that data is reviewed, analyzed by teams at CDC, goes through a rather intense internal review process. I've collaborated with some CDC investigators on a few studies, and it's elaborate, kind of the review that goes up and down the chain to make sure that when something comes out in that publication, it's believable, the limitations are stated, the conclusions really match the data, and then again, it can be used by the public, by health officials, by whoever needs to use that data. So it's very unusual to have a study just not come out, instead of be revised or more aligned to ensure that conclusions match the data in the paper. It's even more unusual to not release a manuscript that is done by the same principles that we've been using for quite some time. That's really tried and true and really solid epidemiology.
Can you talk a little bit about what you know about their reasoning for, pumping the brakes on this?
There's not really transparent reasoning here. And I think that's one of the trickiest things right now is that we really like and need transparency coming from our public health authorities. And it is very reasonable to say I have concerns about this publication or this piece of data is out, but we can only take very limited conclusions away from it because it's early or new. But none of that logic would really go with this kind of study of COVID vaccine effectiveness, because again, this is using a surveillance network called the Vision Network that has actually been set up by CDC, a network of hospitals around the country that CDC collaborates with to ensure it has its pulse on the nation's data. And so they really have all the touch points of designing the study, ensuring data integrity, being able to do analyses as they've done years before. And so this type of study is something we would expect to see come out of CDC. And, I think it's helpful for the public to know there's not a perfect way to do a study. There's not a single one study we ever want. There are all sorts of different ways to approach scientific questions. And this is one type of study design that gives us really good information, particularly when we look at a seasonal vaccine where we think, does this continue to be useful for the public? And so every year we want to have the same kind of review of how is the public responding.
And that kind of segues into this, you work in vaccine education. For a provider out there that might now be fielding more questions from patients, what advice would you give to them about how to handle this?
Sure. So, I think the good news for providers is that in a lot of the past year and a half where we've seen mixed messages and confusing messages, providers have found a few really reliable sources of information, definitely in the pediatric world, American Academy of Pediatrics. In the adult world, we have American Academy of Family Physicians, ACOG, internal medicine groups, and we actually have another group that's been stood up, the Vaccine Integrity Project, that is providing the type of data we typically see from a group like CDC. And so there have been organizations that have stood up that have said, in this time of all sorts of information coming out, we're going to stick to the principles that we've always used and help providers have really good information on vaccines and help them know how to counsel patients. So, for providers, I've been saying, go to those references where things have really stayed the same in terms of their processes and where you understand how they're approaching these scientific questions.
Mm-hmm. So there's been other changes that have been in 2026. Specifically, ACIP's charter was revised. Now, I don't actually know how that legally works. Is that something you could talk about? Could you walk me through that?
Sure. So what we know is it really is under the purview of HHS to change the charter of a committee. And, once the charter is changed, there still needs to be the expected processes that go along with appointing individuals to that group. And so just because the type of individuals on the charter might be different, or there's essentially new types of individuals added, we still would need to see the rigorous review that was done in prior years. So, in past ACIPs, it would take an individual between 1 and 2 years to get appointed to the committee because of the review of their resume, their conflicts of interest, their other responsibilities, and kind of getting them to be lined up to be, you're going to start in July 2028 or whatever it is. And so once there's a new charter, we will see, or we should see, that entire process play out with appropriate reviews and evaluations of people's resumes and do they align with the new charter. So I don't expect to see a new committee quickly form, but it's really yet to be seen if that will get challenged in some way or if that process will be altered in some way that still doesn't align with our expectations of how a new committee should be formed.
Over the last year and a half, it's been a bit tumultuous. I think that's not controversial to say. There's been many changes. These two new developments with the charter changes. And we didn't even mention that there was a federal judge that had blocked some changes too before that to ACIP. And now hearing about data being withheld. What is your outlook for the rest of the year? What are you saying to your colleagues? What are you saying to your patients?
I think there's layers of work going on at CDC that we don't have full transparency around. Some of that work is very good work. We have individuals there responding to hantavirus and doing exactly what we would expect them to do in a public health crisis. So, there are folks, boots on the ground, like doing the good work that we need to be done. What is really tricky as an outsider to the organization really is it's very hard to tell what work might not be done just because positions are unfilled or work is no longer prioritized. And if work is being done, but it doesn't align with leadership, then, what happens to that work? And we just don't have insight into all of that. There's reporting coming out that there's a lot of new research trying to be approached to look at links of vaccines to other conditions that honestly we've already researched and we know the answers to. And so, when you fund studies like that, you divert money away from somewhere else. I don't know where that money is going away from, but that worries me that it's being diverted away from things that our public really needs research into instead of kind of pursuing questions that have been asked and answered. So it's just a really hard time and at CDC at large. And what that means is we are heavily relying on our state health departments. And luckily we have them. And many of our state health departments are really great at what they do. They have great employees. Now their funding may be decreased. They may not be able to do everything that they've always wanted to do, but we do have another layer in the system, and we are seeing more reliance on state health departments communicating with each other, kind of just across state lines, creating coalitions and collaborations, and so that is, I think, a little bit what we might see. And then, what does 2027 hold? I don't know. I would have never predicted a year ago that we would be where we are right now. And so it's just hard to say what direction leadership wants to take and if that will be very, very damaging for the health of children, or if, there will be other initiatives that become more important than changing vaccine schedules. So more to come, but definitely something we're following closely and also pivoting at the same time to other places where we can get good information and advice.
Dr. Lori Handy, thank you so much for taking the time to talk to me.
No problem, anytime.
Don't forget to like and subscribe so you can catch everything from Infectious Disease Special Edition.